Good afternoon, and thank you for being here. Again, my name is Dr. Sarah Cody. I'm the Public Health Officer for the County of Santa Clara. I'm joined today by my fellow public health officers from 7 Bay Area jurisdictions. Together, we cover Silicon Valley and much of the Bay Area region, including San Mateo, San Francisco, Marin, Contra Costa, Alameda, City of Berkeley, and of course right here in Santa Clara County. As of last night at 5 p.m., there were a total of 273 cases of COVID-19 across our 7 jurisdictions. We know that Santa Clara County is the epicenter of this outbreak in the Bay Area, and we know that COVID-19 is spreading rapidly. Today, we stand together to announce additional legal orders that will apply to all 7 jurisdictions covering Silicon Valley and the core of the Bay Area region. These new orders direct all individuals to shelter at their place of residence and maintain social distancing of at least 6 feet from any other person when outside their residence. The order outlines circumstances under which people may leave their residences and defines essential activities, essential government functions, essential businesses, and essential infrastructure. A few highlights. People experiencing homelessness are exempt from this order, but are strongly urged to obtain shelter, and governmental and other entities are strongly urged to make such shelter available as soon as possible. All businesses with a facility in any of the 7 Bay Area jurisdictions, except essential businesses, are required to cease all activities beyond minimum basic operations. All essential businesses are strongly encouraged to remain open to the greatest extent possible. Essential businesses shall comply with social distancing requirements, including when customers are standing in line. All public and private gatherings of any number of people occurring outside a household or living unit are prohibited with limited exceptions, and all travel except essential travel and essential activities will be prohibited. Mass transit will remain open. People may use public transit only for purposes of performing essential activities or to travel to and from work, to operate essential businesses, maintain essential government functions, or essential infrastructure. People riding on public transit must comply with social distancing requirements to the greatest extent possible. This order will take effect at 12:01 a.m. tomorrow, March 17th, and will remain in place for at least 3 weeks. This order was crafted with the 7 of us and our respective county council. It was crafted in order to balance the public health imperative to take swift action to ensure social distancing with the need to preserve basic infrastructure and essential services to maintain our society. I want to remind you and note health services will remain open, grocery stores will remain open, pharmacies will remain open, food can be ordered from restaurants or delivery or carry out, gas stations, banks, and hardware stores will remain open, and essential government services and essential infrastructure will continue to operate. We know that the exemptions to these rules are complicated. They're written for health officers with the help of our legal counsel. And rather than attempt to answer specific questions, we will be posting detailed FAQs on each of our respective websites to help the public and everyone understand what we are attempting to do. I recognize that this is unprecedented, and if I thought last Friday's announcement was hard, this one is exponentially harder. But we must come together to do this, and we have done this as a collective of health officers. We know we need to do this, and we know we need a regional approach. We all must do our part to slow the spread of COVID-19 and ensure that our essential services remain intact and open, most especially our hospitals and healthcare facilities. Now I'd like to introduce my colleague, Dr. Matt Willis from Marin County.
Thank you, Dr. Cody. I'm Matt Willis, Public Health Officer for Marin. It's important to remember that social distancing and sheltering at home does not mean disconnection. You can remain connected to the things you need. The essential things we need will be available to us. Grocery stores will remain open. We're encouraging restaurants to remain open for deliveries. You can get your medicine from your pharmacy. You can still visit your doctor if you have an urgent medical need. You can even take your dog for a walk. We can all expect to start feeling some cabin fever, and it'll be important to remember that we can get outdoors as long as we're practicing those best practices in social distancing that we've been talking about. We are not expecting empty streets, but would rather those who go out are out for those most essential trips, to include getting your necessities. Social distancing does not mean disconnection with each other. Let's be innovative and stay connected with our neighbors, our friends, and our vulnerable elders through calls, texts, and online communication. This is a necessary step for all of us to stay healthy together. I'd like to now introduce my colleague, Dr. Erica Pon, Health Officer for Alameda County.
Thank you, Dr. Willis. This joint action we are demonstrating today in unity to show the importance of how important it is we need to come together as a community and as a region to protect our most vulnerable. We are here to protect the elderly and those with underlying medical conditions. Together, we can slow the spread of disease and protect our parents, our grandparents, and those who need us most to help protect them from serious illness and hospitalization. Thank you. I'd like to now introduce Dr. Aragon from San Francisco.
Good afternoon. My name is Dr. Tomas Aragon. I'm the health officer of the city and county of San Francisco. First, I want to just thank everybody, the health officers, but also all the support that we have been receiving in the prior weeks for everything that we do. We have felt very supported for every action that we've taken, and we're grateful for the continuing support of everyone. In San Francisco, we've had three core goals from the very beginning. One is to protect the public, but especially the most vulnerable populations, to protect our healthcare system and our healthcare workers that we need to keep healthy so that they can take care of us. And the way that we're going to do this is by reducing community spread of this virus. Sheltering in place is a core strategy. By staying home, you reduce your risk of becoming exposed, which means that we reduce the risk of transmission, we reduce the risk of illness and severe disease, we reduce the risk on our the demands on our healthcare system, and thereby we improve the health and social impacts in the long term. Thank you again for everyone for all this support. And as Mayor Breed has reminded us, we're all going to get through this together. We've been through tough times before, and we're gonna do it again. Thank you. I'm going to now introduce the Acting Health Officer of Contra Costa County, Dr. Zieli. Thank you.
Hello, my name is Oritz Zieli, and I'm the Acting Health Officer for Contra Costa County. I want to thank our federal partners and state partners, our firefighters, our elected officials, our municipal partners, our nonprofit partners. This is a time where we as a community all have to come together, and all of us have to work together to get through it. We know this is not the normal way of doing business. It's going to take some sacrifice on all of our parts, but we're doing this for the right reasons. We're doing this to help prevent unnecessary death. We're doing it so we can all stay healthy, and together we can remain a stronger community at the end of all of this. I'd now like to introduce Dr. Lisa Hernandez from the City of Berkeley.
Good afternoon. I'm Dr. Lisa Hernandez. Collective action is powerful, and with no vaccine or medicine for COVID-19, our unified actions have the power to slow the virus and to continue to maintain a healthy community. I want to thank my colleagues here and the colleagues in the City of Berkeley for supporting this effort and continuing to protect the community that we serve. I want to now introduce Dr. Scott Morrow, Health Officer for the County of San Mateo.
Hello, I'm Dr. Scott Morrow, the San Mateo County Health Officer. I do not usually address the press in this format, but I have a very important thing to say. My message is I stand in solidarity and in alignment with my fellow health officers in the Bay Area. I ask the community to follow our recommendations, to follow our advice, to follow our orders, to heed our warnings. We are in a rough place, and we are going to have difficult times ahead of us. The measures that we are putting in place are temporary, but they will last longer than any of us want. This is the time to unite as a community, come to each other's aid, and dig really deep. Find your best inner self and pull out all the compassion and gratitude and kindness you can. Thank you.
We're now going to have a comment from the President of the Board of Supervisors and from the Mayor of the City of San Jose, President Chavez.
Thank you. Thank you all very much for being here today. I know these are a dire direction we're taking. It feels overwhelming. I want to just re-emphasize how important it is that our public health officers are unified in believing that this is the next step we need to take to really slow down the coronavirus. The second thing I wanted to say is a very big and very sincere thank you to all the frontline workers, our emergency responders, people who we're going to need to stay at work, like our grocery clerks, because we're going to want everything to stay open that we can. So today is really about taking the next step, to take cautious next steps about what we need to do to make sure our community is safe. The last thing I want to say, because I know people want to get to questions, is this. We as a community can completely handle this. Our goal right now is to make sure we have as few people as possible straining our medical resources, so we're only using those for people who are most in need. What does this mean? This means being helpful to our neighbors. It means being good to our families. It means finding fun things to do in the house. I've already had friends tell me that this has been challenging. We're going to give you some ideas about what to do about that with your kids. But what it really means is pulling together as a community, as we already are, and I know we will continue to do. Thank you. I'm going to ask Mayor Liccardo to give us some words.
Thank you. Thank you, President Chavez. I support the actions of the health officers throughout the Bay Area to enact a shelter-in-place mandate. We must move aggressively and immediately. The time for half measures is over, and history will not forgive us for waiting an hour more. I appreciate that our residents have endured much already, but this is our generation's great test, our moment to stand together as a community. We need to work together to conquer this virus. And amid our collective fears, we will find uncommon courage. Now, it will take some time for us to get systems in place, and you'll hear me and President Chavez and Jeff Smith and Dave Sykes, who's behind me, and many others talking about those systems in the days ahead. And I'm honored to be joined as well by General Manager of our Valley Transportation Authority. So we appreciate everyone's patience as we're putting in place food delivery systems, child care for many of our healthcare workers and first responders, and the like. We'll need everyone's patience because we'll need to work together. Specifically on the issue of food distribution, I know that is increasingly a concern, particularly with the direction recommendation from the governor that seniors stay in place and those with health challenges also stay in their homes. In collaboration with the County of Santa Clara, the City of San Jose will be taking a lead on food distribution countywide. Our focus is ensuring food security for our most vulnerable residents among the 1.9 million residents of this county. Our principles are very simple. We're going to move fast, we're going to act comprehensively countywide, and we're going to act as one team. There are multiple networks here operating together, and the overwhelming majority of county residents will continue to be able to get their food as they do today, going to the grocery store. And if you're interested in heading to a restaurant, we hope that restaurant will remain open and provide that food to go or drive-through for pickup. Schools are standing up their own food distribution systems, particularly for low-income families whose children depend on that lunch or breakfast they get at school. For example, Eastside Union High School District, San Jose Union Unified School District, and other districts are offering breakfast and lunch to any children under 18. We will focus our delivery efforts primarily on seniors and those with medical vulnerabilities, and we'll be standing up a massive volunteer effort, and you'll hear more about that tomorrow. We wanted to ensure that there was at least enough bandwidth in the media to be able to discuss this in some greater detail, and I think there's probably enough to announce for today. And we're grateful that there are some experienced, excellent nonprofits, CBOs like Second Harvest that will be stepping up in a big way. We're going to use some non-traditional approaches as well, and we'll certainly rely on private sector players. We've reached out to DoorDash and others, and we're going to do this the Silicon Valley way. And we're going to do this in a way that integrates everyone working together to ensure that none of our residents is left behind. So we will be coordinated certainly with other city officials in the cities throughout the county, and of course with the county itself. And we'll be using all the data at our disposal. And fortunately or unfortunately, we've been through a few emergencies in the last couple of years that have enabled us to better identify who's vulnerable, who's what we call a medical baseline patient, where some of those folks are that we definitely need to hustle to be able to serve. So I support the actions, again, that have been announced today. We look forward to continuing to work with our county. And I want to reemphasize one message that you've heard already, which is that social distancing does not mean social diminution. We can continue to be a community. We can continue to find ways to help each other. We're going to need to care for each other to get through this together. And I look forward to exploring with the community the many creative ways we'll be able to do that in the days and weeks ahead. Thank you all.